So we're now going to watch AED, automated external defibrillation. 45% increase in survival with an AED, which is huge. They're great. Remember we talked about the unorganized rhythm. The percentage of the time that you were in a flat line was 20, 80% in another rhythm. So that's why the AEDs are so effective, because they actually stop the heart to get it to reset. So if that person doesn't have a heartbeat, you can't stop a heart, it's already stopped.
Right.
Okay. So, but 80% of the time it's in something else. If it is in a flat line, it says no shock advised, then just continue your CPR until paramedics arrive on the scene. Okay. All right. Let's watch this.
Now let's see a scenario with rescuers from multiple agencies.
The real challenge in situations like this becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved.
I'll let you sit through this because it's, pretty
Express, this is
important.
Engine 1. We're on the scene.
Copy that, Engine 1. Time is 14:55.
Dispatch, we have one vehicle upright, no signs of damage, no hazards noted. We have 2 victims present, one is still in the vehicle.
Engine 1, one vehicle upright, no hazards noted. 2 victims total, 1 still in vehicle.
What's his name? Russ. Hey, Russ, can you hear me? No response?
So what happened?
We were driving and my dad started having chest pains and we rolled into a ditch and he just now passed out.
No breathing. No pulse.
This is cardiac, not trauma. He needs CPR right away. Alert the medics that we have a cardiac arrest to get the AED. Got it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Attach pads to patient's bare chest.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. You're ready to rotate in for compression. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Clear, clear.
Clear.
Shock needed. Charging.
1, 2, 3, 4, 5,
Stay
6,
clear of
7,
patient.
8.
Deliver shock now.
All right, clear everybody.
Clear.
Shock delivered.
1, 2,
Resume
3,
CPR.
4, 5,
Start with
6,
compressions.
7, 8, 9, 10, 11, 12. What we got? 14. Victim in cardiac arrest when we arrived. No sign of trauma. The daughter says he was having chest pains and went unconscious just before we arrived. We shocked him once and we've been at it for about 3.5 minutes.
Thanks. We'll switch out monitors after the next rhythm check.
Jacob, compress a little more deeply and avoid leaning. 2, 3, 4, 5, that's better. 6, 7, 8, 9, 30. One, 2, 3, 4.
Analyzing the heart rhythm. Do not touch the patient.
Clear the patient. Clear.
Shock needed. Charging.
1, 2,
Stay
3,
clear of
4,
patient.
5,
Deliver
6,
shock
7,
now.
8. Clear patient. Clear.
Press the flashing button now.
Shock.
Shock delivered.
1, 2, 3, 4,
Resume
5,
CPR.
6,
Start
7,
with compressions.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3.
Good job with
4,
chest compressions.
5,
Keep it up.
6, 7, 8.
We should
9,
start an IV. Let's
11.
draw.
Hey, I just saw some eye flutter.
Stop compressions. Check the monitor. We have an organized rhythm.
Let's check the pulse.
We've got a pulse. Hey, Russ. Russ, can you hear me? Come on, Russ. Russ, wake up, Russ. No response.
Is he breathing?
No, I'll continue bagging.
Remember to give one breath every 5 to 6 seconds. I'll start an IV.
That's rescue breathing, so breath without
How
chest
easy is the
compression.
bag?
His ventilation's good.
Because they have
Let's get ready
Yeah.
to transport.
have a pulse, organized rhythm. but
Let's
he's
watch
still
this
not
scene
breathing.
again. Pay
exactly.
special attention to the use of the AED and providing breaths by using a bag mask device. When the team members arrive, they assess the scene and try to get a response from the victim. The emergency responder takes a few seconds to check for breathing, looking for no breathing or only gasping, and at the same time, attempts to feel for a pulse. Finding no breathing and no pulse, the team alerts the paramedics en route that this is cardiac arrest. The team moves the patient to a hard, flat surface to begin CPR. One rescuer starts compressions while the second delivers ventilations. A third rescuer sets up the AED and begins attaching the pads to the patient.
During compressions, the compressor counts to 30 so that 2 breaths can be given after each set of 30. The AED is attached and signals that it's ready to analyze. This provides an opportunity for the compressor to switch. We need to point out that it's important to know your AED or defibrillator because there are different models, and it's also important to follow your device's prompts. You may have noticed that the compressor took advantage of the time the device was charging to deliver a few crucial compressions.
High-quality CPR and rapid defibrillation are priorities. The emergency responder operating the AED is responsible for clearing all rescuers to allow for rhythm analysis. If a shock is advised, the emergency responder again clears everyone and delivers the shock.
As soon as a shock is delivered, another set of compressions begins with a different rescuer delivering compressions and using a feedback device. Feedback devices can monitor CPR quality regarding rate, depth, and chest recoil, and provide real-time corrective feedback to rescuers. After each set of 30 compressions, the emergency responder delivers 2 breaths, ensuring that the chest rises with each breath.
The paramedic team has arrived. Now, the team leader directs the handoff without any interruption in CPR by providing a summary of events.
Now let's focus on the use of the AED. You'll need to take a moment to familiarize yourself with the type of AED device used in your training class today. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED. Just open the carrying case or the top of the unit and simply power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's chest by using the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the victim's age, use the adult pads. You may also need to plug in the pads for certain models.
Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple and the other on the victim's upper right chest, directly below the collarbone.
After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the victim's rhythm, followed by a prompt to clear the victim. The rescuer should strongly repeat the command to clear, checking visually to be sure that all rescuers and people receive the command. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. The rescuer should again repeat the command to those nearby. Loudly state something like, "Everybody clear," or simply, "Clear." And visually make sure that nobody's touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered. Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the voice prompts of the AED. If at any time the AED indicates no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if a victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of adult pads, you can apply one set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then
Somebody had to
reapply
really
a new set of the pads.
role play that.
Water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart.
If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump, smaller than a deck of cards. If you see this lump, avoid putting the pad directly over it.
Also, do not place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that model. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on the victim.
All right, girl.